Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot. However, this Kahoot is specifically for the NP student. Students who are studying for PN or even RN, you are welcome, but I made this Kahoot specifically for the NP student, and we're going to be going over conditions and very important disorders that we see specifically in the geriatric population. Now, the way these questions are set up, they are not set up the way you're going to see them on boards. However, the content of the questions, that is what you're going to see, most likely, because I don't write the boards, guys, but there's a very high chance that the content that I'm covering, that is what you're going to see on the board. So it's very important concepts that you need to know in order to answer the question. The reason I can't make this Kahoot, I can't do the questions the way you see on your boards, I have character limit on Kahoot, all right? And the questions on your board, they're long questions. I would run out of characters. But the concept of the things that you need to know, they are in here. This is a very short Kahoot, only about 10 slides, but it's going to be very helpful if you are studying for your boards, whether it's AANP or ANCC, it will still be helpful for you. Don't forget, guys, I'm now offering NCLEX next generation NCLEX review sessions, part 1 and part 2. You can reserve your spot by going to my website, nexusnursinginstitute.com, and almost daily you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, and Facebook. My handle's the same everywhere, Nexus Nursing. Be sure to check that out. And last, the students who are currently in the nursing program, you haven't graduated yet. You're not worrying about NCLEX. You're just trying to survive the nursing program. You're trying to pass your test. I have audio lessons available for you. Check those out on my website, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Geriatric disorders for the NP student. First question, what is the most common infection in older adults that are older than 65? Is it pneumonia? Is it urinary tract infection? Is it pyelonephritis? Is it bacterial endocarditis? Is it sepsis or glaucoma? What's the most common infection found in older adults? This is important. You guys need to know this. Very good, UTI. Urinary tract infection, that is the most common infection that we see in the older adult. Now, let's talk about the other choices that we'll come back to the UTI. Pneumonia, pyelonephritis, which is an upper urinary tract infection, bacterial endocarditis, and sepsis. All of these are common infections found in the older adult, but this question is asking for the most common infection, and it's UTI. What about glaucoma? First of all, glaucoma isn't an infection. What is glaucoma? Glaucoma is increased ocular pressure, right? So that is not even an infection. So yes, glaucoma is commonly seen in the older adult, but it's not an infection. Now let's go back to UTI. A couple things you guys got to know about UTIs and the older adults. Boards expects you to know this. When it comes to the geriatric community, when the patient has an infection such as a UTI, they usually will have atypical symptoms. So the normal symptoms that you would see, such as increased WBCs or, fever, elevated temperature, you don't see that in the older adult. If anything, actually, the patient's body temperature may be lower than normal. If the WBCs, you may not see it elevated in the blood. You take the urine, you may see some WBCs in the urine. The most common symptom that you'll see, actually, that should lead you to the thought, okay, maybe this patient has an infection, is confusion. So if you have an elderly patient that presents to your office and you see that the patient was previously awake, alert, oriented, there was no problem with confusion, disorientation, lethargy, them suddenly being discombobulated or falling, you better suspect maybe there's an infection present. Most likely UTI. Make sure that you get a urinalysis on that patient. All right, type in your answer. So your geriatric patient presents with a one-sided tenderness over the temporal artery. They have sudden vision loss in that same side, the same that eye on the affected side, and scalp tenderness on that affected side. You check the sedimentation rate and it's increased. What do you suspect your patient to have? Geriatric patient, one side tenderness over the temporal artery, sudden vision loss, scalp tenderness, and increased sedimentation rate. What do you suspect? Okay, I'm seeing a lot of stuff. The correct answer is very good, temporal arteritis or giant cell arteritis. And here is the key, because I saw a lot of stroke, right? I get it, but guys, let me move this so we can talk about this. Geriatric, yep. One-sided tenderness over a temporal artery, that's first red flag. Sudden vision loss, scalp tenderness, second red flag. And here's the key, guys. Increased sedimentation rate. When do we see the sed rate increase? Inflammation, right? So that increased sed rate, even if you were thinking stroke, which at the beginning I would think stroke too. Matter of fact, if this question was asking you for differential diagnoses, right? A cerebral vascular accident, a stroke, that would be part of your initial differential diagnosis. But when we're looking at that tenderness over the temporal artery, that scalp tenderness, especially increased sed rate, you need to be thinking of temporal arteritis. Okay, this is a medical emergency. The patient can go blind. We don't play with this. This patient needs to go to the ER immediately. Okay, so your patient has severe pain, severe headache, nausea and vomiting. Their eye or eyes are reddened and there's profuse tearing. They're complaining of blurred vision, halos around lights. They're seeing halos around lights. What do you suspect this patient's diagnosis to be? Would it be CVA? Would it be an acute migraine? Would it be acute closure glaucoma? Or would it be severe bacterial infection? What do you guys think? Okay, very good. Most of you guys went with acute closure glaucoma. Let's talk about this. So, as I mentioned, when it comes to glaucoma, that's that increased ocular pressure. That ocular pressure is going to be higher than 21, right? Here's the thing. Severe pain, not just normal eye pain, pain, severe headache, halos around lights. You should be thinking of acute closure glaucoma. Let me tell you something. This is an ocular emergency. Remember how I told you the pressure is definitely going to be under, excuse me, not under, over 21? Well, here's the thing. The way you test it is with a tonometry. If you suspect your patient has acute closure glaucoma, you get them out of there. You want to know what you're doing? You're calling 911. It's not one of those other situations where this is beyond your scope and you're sending that patient to the hospital. You tell them to go to the hospital right away. You dial 911 and you have them come get this patient immediately. You get that patient out of your office. You don't want those type of problems. Yes, the tonometry is going to be done, but guess where it's going to be done? In the ER, not in your office. The minute you suspect that this patient has acute closure glaucoma, you're calling 911 and we're booting that patient out of there. They got to go to the ER. Okay. True or false? The kidney size and creatinine clearance decreases with aging. Is this true or is this false? So with aging, does the kidney size decrease? Does the creatinine clearance decrease? Is this true or false? True. True. It's wear and tear on the body, especially when it comes to the kidneys and the liver. It just starts to just not function the way that it used to. And the reason we're so concerned about it when it comes to geriatric patients, just like the liver is responsible for metabolizing drugs. So the older the patient is, right, the weaker that liver is, the less the drugs are going to be metabolized, the more that patient's at risk for toxicity. The kidneys are responsible for excreting these drugs. So with the creatinine clearance decreasing, that kidney size decreasing, guess what? The patient's not getting as much of that drug out of their body and they're going to be at risk for toxicity. And that is why it is so important when it comes to the geriatric patients, whatever medication that you're ordering for that patient, you're always going to start at the lowest dose. You're going to start low and go slow. Select all that applies. What are the top 3 leading causes of death in the geriatric community? Is it heart disease, AIDS, falls or injuries, cancers, COPD, elderly abuse? Choose 3. Select all that apply, but choose 3. What are the top 3 leading causes of death in the geriatric community? I'm seeing a lot of you guys having 2 out of 3 on the live. Okay, let's talk about this. So the first one, very good, heart disease. Them having a heart attack, myocardial infarction, heart failure, arrhythmias. Next, cancers. And the 2 cancers, I think that's another slide, so I'm not going to say which 2 cancers, but cancers and COPD, emphysema, bronchitis. Absolutely. Okay, type in your answer. Which type of cancer has the highest mortality rate for both genders, men or women? Which type of cancer has the highest mortality rate? Now, guys, there is a difference between morbidity and mortality. Morbidity is illness, mortality is death. So we're talking about death rates, highest mortality rate for both men and women. Type in your answer. Lung cancer. That is the number one cancer that causes the highest mortality for both genders in the geriatric community. I saw a lot of the number 2 cancer. So let's talk about that. Type in your answer. Which cancer has the second highest mortality rate for both genders? You guys have to know this for boards. Make sure you know it. Which cancer has the second highest mortality rate for both genders? We know lung cancer was number 1. What's number 2? Colon cancer. Very good. Number 1, lung cancer. Number 2, colorectal cancer or colon cancer. And here's the thing, guys, with both of these types of cancers, the most common risk factor is aging. The older that you get, the higher your risk factor for both of them. True or false? Smoking is the most common cause of lung cancer. Is that true or is that false? Okay, very good. Most of you guys chose the correct answer. That is true. After smoking is radiation therapy, having a history of exposure to radiation. All right, true or false? A chest x-ray is a golden standard as far as being a diagnostic test for lung cancer. Is this true or is this false? The chest x-ray is a golden standard for diagnostic testing of lung cancer. Very good. I'm so happy you guys were not tricked. False. What is a gold standard? Guys, do you know what the gold standard on the live is? Yep, that's right, Anita. biopsy. That biopsy, that is a golden standard. The chest x-ray is still a screening tool, right? It lets us know something's there, but how do we confirm it? That biopsy. All right, type in your answer. The first baseline colonoscopy should be performed at what age? The first baseline colonoscopy, that should be performed at what age? I'm seeing that everywhere. 50. Very good. Most of you guys got it on the live. Very good. Oh, Sid says they changed it to 40, I believe. Sid, I'm not going to say that's not right, but I'm going to double check on. Guys, I'll put in the comment section for you. I'm pretty sure it's 50, but listen, I may be wrong. I'll double check on that for you. And I'll put in the description box of the video. All right, select all that applies. Which drugs have higher risk of adverse effects on the elderly? Select all that applies. I'm sorry, I gotta move my face. Antihistamines, benzos, narcotics, digoxin, anticholinergics, atypical antipsychotics. Which drugs have a higher risk of adverse effects on the elderly? While you guys are thinking about that, let me go back to that colonoscopy question, which I got to double check on for you. But anyway, after that initial colonoscopy, routinely, unless the patient has high risk factors, it's after that it's going to be 10 years. Okay, that's something else I wanted to mention to you because you do have to know that as well. All of them. All of these drugs have higher risks or potential for adverse effects on the geriatric patient. Remember, the kidneys and the liver is not working the way it used to, so they're not metabolizing the drugs the way they used to. They're not excreting these drugs the way they used to, and they have some serious adverse effects, especially in the elderly. So let's talk about antihistamines. So like Benadryl, I can never pronounce the Benadryl, diphenhydramine is so sedating, right? So if you want to order this for the patient, let me tell you what a better option is for the geriatric patient. You'd order something like what? Claritin, because it doesn't have the sedating effects that Benadryl has. So that's something that you have to consider for your geriatric patient. Benzodiazepines, the patient can be at risk for falls. Narcotics, narcotics depresses the system, depresses the heart rate, can depress the respirations, it can depress the blood pressure, it could cause falls. We're going to be concerned about that for the patient. Digoxin. We love digoxin, especially patients got heart failure. It increases the contractility of the heart. Great. But something we need to know about digoxin, especially in the older adult where the kidney and the liver is not working the way it used to, if that patient ends up in dish toxicity, we have some big problems. Okay, the patient can have vision problems, depression, fatigue. But out of all of those adverse effects, we're really going to be concerned about vision because along with that can cause falls and other issues. Anticholinergics. You know how I feel about anticholinergics. Remember, anticholinergics can't see, can't spit, can't pee, can't, right? So with the anticholinergics, out of all those adverse effects, again, what are we going to be concerned about? Vision. Last, atypical antipsychotics. Let me tell you how dangerous atypical antipsychotics are for the geriatric patient. There's a black box warning on them. Those geriatric patients that have dementia, you mess around and you order an atypical antipsychotic for that patient, you're going to mess around and lose your license. Okay, this is very dangerous for the patient. You do not order any type of atypical antipsychotics for the geriatric patient with dementia. That is a big no-no. So all of these drugs, you have to be very, very, very careful when prescribing to the geriatric adult. And guys, I feel like this was such a fast Kahoot. What do you guys think? I feel like this went pretty quickly. However, I did promise I'm going to be making more Kahoots for the NP students because I haven't been showing you guys as much love as I should. So I'm going to try to balance it out. Let's see how you guys did.